Quitting tobacco? The Oklahoma Tobacco Helpline is here to help. We provide at least a 2-week supply of free nicotine replacement therapy. NRT is a safe way to replace nicotine and can help with the difficult withdrawal symptoms and cravings. 3 of the most common types of NRTs are patches, gum, and lozenges. When used correctly, NRTs can double your chances of quitting. Many tobacco users find NRTs helpful for quitting. Every person is different. It might be worth trying NRTs to see if it's right for you. Think of it like this. Living tobacco-free is like learning to ride a bike. NRTs are your training wheels. They help you find your balance and keep you on track on your path to quitting. When you sign up for free services through the Oklahoma Tobacco Helpline, you'll get at least 2 weeks of free NRTs, including your choice of patches, gum, or lozenges. Different NRTs work better for different people. Patches offer a discreet, low-maintenance option with a measured, steady release of nicotine. Lozenges and gum are fast-acting NRTs you use in your mouth. Used correctly, they can give you an active way to deal with cravings. Contact the helpline or your healthcare provider to choose the right NRT for you. Quit coaches are available 24/7 to answer your questions, and they'll be by your side throughout your journey with non-judgmental support.